Hello friends, welcome to my YouTube channel Nursing Classes. A place where you get all nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम DSSSB नर्सिंग ऑफिसर एग्जाम 28 अगस्त 2019 शिफ्ट 3 का क्वेश्चन देखने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरे YouTube चैनल को सब्सक्राइब नहीं किया है तो प्लीज सब्सक्राइब करें और बेल आइकॉन पे क्लिक करें जैसे कि वीडियो अपलोड होने पर पहले नोटिफिकेशन मिले। और वीडियो अच्छी लगी तो अपने दोस्तों के साथ शेयर करें। चलो अब शुरू करते हैं। 1. What comes under category 1 of the biomedical waste segregation? A. Animal waste. B. Microbiological and biotechnical waste. C. Human anatomical waste. D. Discarded medicines. Correct answer C. Human anatomical waste. 2. By performing which of the following actions can a nurse increase the base of support? A. Spacing the feet farther apart. B. Bending the knees. C. Tensing the abdominal muscles. D. Leaning slightly backward. Correct answer A. Spacing the feet farther apart. 3. What is the purpose of a retention enema? A. To reduce bowel action. B. To empty the bowel. C. To relieve distension caused by flatus. D. To soften the hardened feces and gently stimulate the peristalsis. Correct answer D. To soften the hardened feces and gently stimulate the peristalsis. 4. What is the recommended dietary allowance RDA of calcium for a 9-year-old child? A. 200 gm. B. 600 gm. C. 400 gm. D. 800 gm. Correct answer C. 400 gm. 5. What is value clarification? A. Process of identifying, examining and developing one's own individual values. B. Process of explaining, describing values of a person. C. Process of identifying and developing social values. D. Process of identifying and examining the values of other individuals. Correct answer A. Process of identifying, examining and developing one's own individual values. 6. Which statement is not true regarding kwashiorkor? A. Monkey face. B. Silky, easily pulled hair. C. Edema present in the lower limbs and arms. D. Poor appetite. Correct answer A. Monkey face. 7. Identify the proteolytic enzyme present in the gastric juice. A. Peptidase. B. Trypsin. C. Chymotrypsin. D. Pepsin. Correct answer D. Pepsin. 8. Chelosis is the deficiency of A. Vitamin B3. B. Vitamin B6. C. Vitamin B2. D. Vitamin B1. Correct answer C. Vitamin B2. No. Clinical manifestations of dehydration include all of the following, except A. Dry mouth, iron lips. B. Headache and lightheadedness. C. Small amounts of dark urine. D. Dry and brittle nails. Correct answer D. Dry and brittle nails. No. Clinical manifestations of dehydration include all of the following, except A. Dry mouth, iron lips. B. Headache and lightheadedness. C. Small amounts of dark urine. D. Dry and brittle nails. Correct answer D. Dry and brittle nails. 11. What is at the highest level according to Maslow's hierarchy of human needs? A. Safety and security. B. Self-actualization needs. C. Physiological needs. D. Love and belongingness. Correct answer B. Self-actualization needs. 12. Which of the following occurrences does a nurse have to observe for in vagal nerve stimulation while removing fecal impaction? A. Tachycardia. B. Elevated body temperature. C. Bradycardia. D. Pain. Correct answer C. Bradycardia. 13. Which of the following findings of an abdominal auscultation should a nurse report immediately to the doctor? A. Loud bruit over the aortic area. B. High-pitched bowel sounds. C. Absence of bowel sounds for 20 seconds. D. Absence of arterial bruits. Correct answer A. Loud bruit over the aortic area. 14. How much water must be added to 150 milliliters of a 1 in 20 solution to make up 1% solution? A. 30 milliliters. B. 60 milliliters. C. 90 milliliters. D. 120 milliliters. Correct answer B. 60 milliliters. 15. Continuous musical sounds heard on expiration are called A. Bronchial sounds. B. Pleural friction rub. C. Wheezes. D. Crackles. Correct answer C. Wheezes. 16. What is the immediate intervention to be performed on a mother at term gestation who is experiencing moderate vaginal bleeding, indicating abruptio placenta? A. Complete bed rest for remaining period of the pregnancy. B. Strict monitoring of intake and output. C. Weekly monitoring of coagulation studies until the time of delivery. D. Delivery of the fetus. Correct answer D. Delivery of the fetus. 17. Which of the following assessment findings suspect the diagnosis of placenta previa? A. Bright red colored bleeding. B. Abdominal pain. C. Placenta in the upper segment. D. Tender uterus. Correct answer B. Abdominal pain. 18. Which of the following is a type of hypertension with proteinuria and convulsions during pregnancy? A. Chronic hypertension. B. Gestational hypertension. C. Eclampsia. D. Preeclampsia. Correct answer C. Eclampsia. 19. The temporary accumulation of epithelial cells formed on the hard palate in a neonate are called A. Sucking closities. B. Epstein pearls. C. Supernumerary teeth. D. Retention cysts. Correct answer B. Epstein pills. B's. Which nursing intervention is a priority while caring for a woman in labor with hypertonic uterine contractions which are erratic in their frequency, duration, and intensity? A. Prepare the client for an amniotomy. B. Promote ambulation 30 minutes every. C. Provide pain relief measures. D. Provide oxytocin augmentation. Correct answer C. Provide pain relief measures. 21. Which of the following assessment findings of a pregnant lady determine that she is in the second stage of labor? A. Membranes have ruptured. B. Cervix is dilated completely. C. Contractions are regular. D. Begins to expel clear vaginal fluid. Correct answer B. Cervix is dilated completely. Bias. Who has developed the theory of emotional development? A. Sigmund Freud. B. Lawrence Kohlberg. C. Eric H. Erikson. D. James Fowler. Correct answer C. Eric H. Erikson. 23. What is the relationship of the long axis of the fetus to the long axis of the maternal spine? A. Lie. B. Presentation. C. Attitude. D. Denominator. Correct answer A. Lie. 24. In which of the following malpositions there is a saucer-shaped depression observed, at or just below the umbilicus, on abdominal examination? A. Occipito-posterior position. B. Occipito-anterior position. C. Mento-posterior position. D. Mento-anterior position. Correct answer A. Occipito-posterior position. 25. Which one of the following is an example of a chromoprotein? A. Hemoglobin. B. Mucin. C. Glutenin. D. Casein. Correct answer A. Hemoglobin. वीडियो कैसा लगा कमेंट करके बताएं और अपने दोस्तों के साथ शेयर करें। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज़।